Well, what about heartburn? If yours has turned into an inferno, you might be a victim of acid reflux disease. Regular sufferers know the importance of avoiding certain foods, but Dr. Siegel has some advice also on what foods you might want to be adding to your diet.
Petty Ann, I love this topic because all I do all day long is tell people what not to eat.
Yes.
You know, I say elevate the head of your bed, drink plenty of water, but then I say, you know, stay away from chocolate, coffee, alcohol, nuts, caffeine. Now, what do you eat? Well, you look for foods that aren't acidic. That's what you do. Bananas, oatmeal, oats, apples. Now, I always say for people, stay away from nuts. I found out this week you can eat almonds. Almonds are the one nut that you can actually eat that decreases your risk of reflux. And also, cooked vegetables are good. Cooked green beans, string beans, broccoli, cauliflower. These decrease the amount of reflux. And the theory is, because instead of eating acidic food, you're eating non-acidic food. But the best food of all is water. The more water you drink. And the goal here, by the way, if you can treat it with foods, you may be able to stay away from medication. Because the medication decreases the acid, so maybe the food will do it and stave that off for a while.
Right, and one of the things with water is that if you're drinking more water, maybe you're drinking less of the bad drinks like the sodas and the coffees that just aggravate.
You know, we love coffee on this show, and we've talked many times of the great benefits of coffee, but when it comes to reflux, it can be a problem.
Yeah, also chicken without the skin. And brown rice?
Chicken without the skin is the worst for you. Brown rice, again, it fills you up and it's neutral.
All right. Well, what about these medications that he mentioned?
Well, I think the biggest ticket in this whole thing is fatty food. Fatty food is the one that relaxes the actual sphincter and the acid can go up. Smoking and alcohol plays a big role, but chocolate is the one that has all of that. It has the caffeine, it has the cocoa, it has the fat, so you want to stay away from it. One of the reasons why I became a surgeon is to tell the patient they can eat whatever they want and take care of the cancer and everyone is happy. Remember ginger and parsley. Ginger and parsley is what you need to take care of this. But really, this is about lifestyle changes because a lot of people can take all the H2 blockers and all the over-the-counters. You need to change your lifestyle. You've got to make sure that you eat less. You eat early, you eat frequently, and chew your food. That's how the acid would work. Stay away from eating too late at night because you eat late, you lie down flat, the acid will go up. If you have to do it, you take chewing gum, and that takes care of some of the acid. Ultimately, there are some people that have defective valves, and they don't know. And they are surgical. Again, the surgeon talking about surgeries. But there are effective surgeries called fundoplication that can take care of it. We see sometimes hiatal hernias, where the stomach is actually has shifted into the chest. Make sure you see a GI doctor, gastroenterologist, and not take over-the-counter medications on your own. That's the key.
And lose weight, Petty Ann. Losing weight is a really important place to start. Not you, not you.
Just kidding.
All right, good, Marc.